Hey everyone, this is Victor from Cyborg for Life. Today I have a very special interview for you. She is the head of bone and joint infection and world expert in limb lengthening at the Rubin Institute for Advanced Orthopedics at Sinai Hospital in Baltimore, Maryland. Please enjoy the interview with my doctor, Dr. Janet Conway.
All right, everyone. Today we have a very special guest joining us. She is a world leader in limb lengthening and head of bone and joint infection at the Rubin Institute for Advanced Orthopedics at Sinai Hospital in Baltimore, Maryland. With an innovative expertise that has saved bones and lengthened numerous limbs, explains why patients are choosing her to help them get taller and reach new heights. Please join me in welcoming world-renowned orthopedic surgeon, my doctor, and queen of limb lengthening herself, Dr. Janet Conway. Hey, Dr. Conway, how are you?
Good. Hi, Victor.
Oh my gosh, Dr. Conway.
Thank you for that nice introduction.
Nice introduction. You deserve way, way more. That's the least I can do. So before I begin, I just want to, publicly thank you for what you do. When I was planning to get limb lengthening surgery done 8 years ago, I was completely nervous and I didn't know a lot about the procedure. But after meeting you and you explaining it to me, it just, I felt my nerves were at ease and I felt reassured and I was ready to, actually a little excited to get it done, as weird as that sounds. And ever since getting it done, it's changed my life. I'm living life to the fullest. So, and I'm going to try to keep helping people do the same. So thank you. Thank you.
Oh, you're welcome.
She's acting like it's a piece of cake, but all right. So your qualifications and accomplishments are top notch. You earned your medical degree from Georgetown University, residency at Thomas Jefferson, and fellowship subspecialty training in limb lengthening and deformity reconstruction with Dr. John Herzenberg and Dr. George Paley, and then coming to the International Center of Limb Lengthening at Sinai Hospital in 2001. With over 20 years of experience and an amazing track record of success, it shows why patients from over 60 countries come to you for their limb lengthening goals to achieve the best possible result. So to give us some context, what kind of got you into limb lengthening? Like, what kind of drew your interest to that subspecialty?
Well, it was kind of a funny thing, but when I was a fourth-year resident, I went to the American Academy of Orthopedic Surgeons meeting. Mm-hmm. And so I always liked trauma. And so I went to one talk on tibial non-unions, and it was by a guy named David Lowenberg, and I consider him one of my mentors. And so he gave an amazing talk about how these patients had a ton of operations and they still had non-unions, and he had fixed their deformity and their limb length discrepancy and got their non-unions to heal with the Elizarov device. And I was like, and he showed videos of patients walking and they had walking, and I was like, this guy is the man. I'm like, I got to learn this. This is amazing technology, right? I'm like, people were going to him saying that, they should get their legs cut off. And he's like, wait, I got it. And so after seeing him give this lecture, I was like, then I started researching, like, where can I learn how to do this? Mm-hmm. And it was good timing because you apply for your fellowships in your fourth year of residency. Mm-hmm. And so I had, because my husband was doing, medical school and his PhD, I had about 2 years where I wanted to do some fellowships. So I did trauma fellowship, and then right in the middle of my trauma fellowship, I did the limb lengthening and deformity correction fellowship with Roar and John. Mm-hmm. And it was great because, it was just everything I ever wanted to learn about taking care of these complex patients and, saving people's legs. And, this limb lengthening technology is just evolved over the course of, since I started. I mean, before it used to be all these Elizarov wires and circular external fixators, and then the PRECICE nail came along, and it was such a game changer for everyone. The first couple versions were these nails where you had to rotate the patient's leg. It was called the ISKD, and it was you probably heard of that, but the first generation of nail lengthening nails, it was really painful. And so when this magnetic lengthening nail came out, the PRECICE nail, it was just phenomenal because the patients could do it themselves. It wasn't painful, and really changed everything. It's really so fun to see all the technology evolve.
Yeah, completely. And that's actually one of the reasons why I decided to get it done. You said, I thought it was the Elizarov that I would have to get, the Taylor spatial frame or something. You're like, no, we have this new technology. And I was like, really? You explained it to me. I was like, let's do it. So it was super cool. Awesome. So yeah, you're well versed in multiple orthopedic disciplines, from bone and joint infection, deformity reconstruction, to fixing limb length discrepancies. The list goes on. But today I want to focus on the stature lengthening, as it's becoming more and more popular, as you probably know, for increasing one's height. So when prospective patients reach out to you, one of their main concerns is trying to get as tall as possible. And they go to the surgeon and they say, hey, look, this is my goal. I want to achieve this. But the most important thing for the surgeon to do is to do that safely. So how do you decide how much length a patient can get in each bone, like the femur or the tibia, with these internal lengthening rods?
Sure. Well, some of these lengthening rods have inherent limitations. So, 8 centimeters is about what you can get from a one go at the nail. Right. So, that in and of itself, like that stops the lengthening with, one surgical procedure just from the 8 centimeters. But depending on the person's, initial height, and depending on the length of their bone, you can, lengthen up to between 20 and 30% without complications. Once you start to get over 30% of the bone, initial bone length, you start to get into a tremendous amount of complications. And so, depending on like the width of the person's bone and depending on the length of the person's, the initial length of the person's bone, is really sort of determines how far you can go without a lot of complications. And then, so with that being said, a lot of people can usually get 5 centimeters without a horrible problem. Like that is, like when people walk into my office, I can pretty much guarantee that they can get 2 inches. That's pretty much like without a big problem and without a lot of effort on their part, 5 centimeters or 2 inches is pretty safe. And I would say, 95% of people could walk out the exact same with 5 centimeters of the femurs. If you want to do the femurs, the tibias, depending on how short the person is and how long the patient's bone is, 5 centimeters could be a lot for those small, like 4'10", like 4'6", 4'7", like you're starting to get into that overall percentage of lengthening that starts to get more complications, like with bone healing or muscle contractures. So just depending like on the, but if someone walks in with femurs and they want to get 5 centimeters, I feel like that's pretty safe. When you're starting talking about tibias, it gets a little more dicey just because of the initial length of the bone. But, you just have to pay attention, I think.
Right, yeah. And a lot of people, they're willing to actually do both sets of bones. Do you recommend, let's say if they wanted to get 6 or more centimeters, that they split it up then, like among the tibia and the femurs, and separate the surgeries between a certain amount of time?
Sure. I mean, I think if you want to, I think some people, I even got a question the other day about they don't want to affect their athletic ability and they want to try to do both bones. And so I would say that it takes 2 years to really recover fully from a limb lengthening procedure. And so if people wanted to if their goal, it depends on what their goals are. If they want to get as tall as possible, as quickly as possible, then you might want to separate it out by, a shorter period of time. But if they want to maintain their functionality as, their athletic ability, I would say do your femurs, recover for 2 years, and then come back and do your tibias. And I think that would probably be, as far as maintaining your level of, like say people like to run and they want to do marathons or whatever, I would say don't do everything all at one time, or don't separate them out by 6 months apart. I would start to wait a lot longer for that. I feel like that would be the safest way to go, because at the end of the day, my job with the stature lengthening is to have people walk out of the office the same way they walked in, just taller. And, that's really important to me because, it's just, it's something that it doesn't necessarily have to be done,
right.
And so safety first. And the nice thing too about some of these things, and I've had a lot of discussions with a lot of people about the stature lengthening, is that these PRECICE nails, you can lengthen, say 5 centimeters, right? And then say the person wants to get taller later, but you still have that nail in there that has the 8 centimeter capability. You can kind of wake up the sleeper nail. So it's been healed, the nail's in there. You could still go back, cut the bone, and get 3 centimeters more. Do you see what I mean?
That's
so
cool.
It's kind of fun.
Yeah.
It's a option.
I didn't know that.
But a lot of times, like, say we've had a bunch of these cases where, we've lengthened and then either a patient had a contracture or whatever, and we stopped and they healed and they got rid of their contracture and they still want a little bit more. We can cut the bone and go back, and the nails have been fully functional even after we've, not lengthened for a year or two. And so that's awesome because it just gives us the ability to make it safe to get, you can stop and then go back and get the extra length later. So I don't know, it's kind of another way to look at it, without going crazy, doing another whole set of bones and being safe the first time, getting the 5 or 6 centimeters and then waiting and then coming back. So I don't know. I always feel like, that's my goal, safety, like you said, safety first.
Right. Yeah, definitely. And I think that, like you said about the muscle contractions and stuff, that's another thing. Obviously, you want to monitor the patient's bone formation, avoiding muscle contractions and whatnot. Does that regulation of lengthening rate, does that play into how fast you should distract the bone? Like typically, the average, I think I did it with you, close to about 1 millimeter per day. But depending on the person's age and stuff, does the distraction rate change?
Well, I think it depends on a couple things. Usually, like you said, the standard's 1 millimeter a day, and you can do like 0.3 3 times a day. But it depends on how well the bone is healing. And so if you're seeing nothing after the person's distracting, you can slow them down. The other dangerous thing is if the person is making too much bone, then you don't want the nail to heal or the bone to heal before you've reached your goal. So sometimes speed it up a little bit, but like you mentioned, the muscle contractures, it's sort of a catch-22. You don't want to speed up the bone too fast and get these nerve or muscle issues. So you really have to be paying attention. And that's why it's so important to come back like every week or every other week to just check, And so that's another thing when you get to that, like, when you start out, it's not so bad because your muscles aren't really, they're not stretching that much, 1 millimeter or 2. When you start to get into the end ranges, like the 5 centimeters or 6 centimeters and even longer, those muscles have had to grow all that length too. They're tight. And so you can slow the rate down as you get further along. One, because the bone is, maybe not as robust as you're getting towards the end ranges of the lengthening. And you might have the luxury of slowing down. And 2, you have to make sure that those muscles catch up with the bone healing. So maybe in the beginning it's 1 millimeter a day, and then as you get further out, sometimes you slow it down, 0.75 a day, maybe 0.5 every other day, just depending on how the patients are doing.
Yeah, and that all goes back to like the checkups and stuff, and being very close to your doctor and not traveling back and forth. But I mean, you as a very experienced specialist in bone and joint infections, non-unions, contractions and whatnot, I mean, people are in super good hands if they go to you, but people still worry about complications. I mean, I had nothing to worry about, but like, what advice do you give to a prospective patient who is in the process of selecting a surgeon and is worried about complications? Surely experience matters. I mean, you've been in the game for over 20 years, but also knowing how to troubleshoot along the way. Like you said, those checkups are super important. What type of signs and symptoms do you look for in a patient who's lengthening for that 5 centimeters or a little bit more?
Sure. Well, I mean, I think you asked 2 questions. The first one was about how to pick your surgeon. So let me just, a couple things. Like, I think that I'm a fan of the stature lengthening in with surgeons who are experienced in limb lengthening. So, like, if someone just does cosmetic stature lengthening as like, if that's all they do, then they have a lot of experience. But if they kind of dabble in it a little bit and don't really do like a lot of other limb lengthening procedures, I feel like they might not know as much as far as, handling the complications. So, I think experience really matters. So if they've done training in limb lengthening, they've had a fellowship, they, have been doing it for a while, you don't want to go with someone who's maybe in their first year or 2 of practice and this is something that they're just starting to get into, or if they want to just take advantage of the new technology. the funny thing when the PRECICE nail came out is when all this, started coming about, everyone was like, oh my gosh, it's going to be such a problem because everyone can put a rod in. Everyone knows how to put a rod in. All the trauma surgeons know how to put a rod in. This is going to take off. And so that was like the company's worry. That was like a lot of like the experienced limb lengtheners worry.
Mm-hmm.
But because it requires such a close follow-up and because it requires such a knowledge of what can happen as you're lengthening the bone,
right.
I think it hasn't been as the worry is not there so much that patients, like the doctors are just, making everyone taller because the technology is available.
Right.
I think people who are doing it, I think do it with the respect that they have for the bone and soft tissues,
Mm-hmm.
And so I feel like if you go to someone, they just have to have that experience. Like the limb lengthening, this is not just the only thing they do in the limb lengthening arena. They, you want someone who's like, my limb lengthening colleagues have had a lot of experience,
Yeah.
So I just feel like that's important. And so then you're asking me, the other question was, what things do I look for?
Yeah.
When, someone's doing the limb lengthening. So things I look for, like if you're doing femoral lengthenings,
mm-hmm.
you want to make sure that they're stretching their hips. They're not getting hip contracture. You want to make sure they can lay on their stomach.
Mm-hmm.
You want to make sure, like, as they're coming into your office and doing their physical therapy, they can bend their knees when they're laying on their stomach and stretch their whole quad and the rectus muscle.
Mm-hmm.
You're also looking for some weakness or numbness or tingling in their foot, mm-hmm. because they're starting to have trouble straightening their knees. You want to stretch their hamstrings. You want to make sure that they're not getting any subtle signs of peroneal nerve entrapment.
Mm-hmm.
And then sometimes even with the stature lengthenings, I'll do an IT bearing release, and sometimes if I'm going for a lot, I might just do the peroneal nerve decompression at the same time.
Right.
So that it's all done, and I don't have to stress so much if they're getting symptoms. I don't want to go back in the middle of lengthening and have to do a peroneal nerve decompression because, everyone is sort of paying up front for the surgery, and if you don't do it ahead of time, it looks like a complication.
Yeah.
You see what I mean? And so half the issue with going to someone who's knowledgeable is troubleshooting before the trouble happens.
Right.
And so if I kind of like release the IT band and maybe do a little Botox, quad or hamstring if I can do it, and do a little peroneal nerve decompression right off the get-go for the femurs,
mm-hmm.
then I feel like I've set myself up for keeping myself out of trouble.
Gotcha.
Yeah. And so if I didn't do those things, then I really get worried about contractures and
mm-hmm.
Nerve symptoms, and it's hard to talk someone into going back to the OR, especially when it's cash up front. Do you know what I mean?
Right. Definitely, because those complications, you definitely want to get those. So Dr. Conway, a very common concern among interested leg lengthening candidates is how long is it going to take them to recover from the surgery? Obviously, everybody has different rates, but what is the average time that you've seen for somebody who's undergoing femoral lengthening or tibial lengthening, like from surgery to maybe, let's say, starting to take walking without assistance, whether they got the stride nail or the PRECICE nail? Because obviously the PRECICE nail is not as weight-bearing, can't handle as much weight load as a stride nail. What's the typical time frame that you see for that turnaround?
Sure. Well, I would say, it's sort of an interesting thing because a lot of the typical patients who would see us are maybe in their 20s.
Mm-hmm.
And so a lot of times they'll come at the end of May, after the semester is over,
mm-hmm.
and want to get something done as soon as possible so they can go back to school in August.
Okay.
And this is sort of like, if you start at the end of May, you can get 5 to 6 centimeters and be walking at least with crutches by the end of August, and then maybe in September, walking without assistive devices. And so it's something they can get done, sort of what they did on their summer break, so to speak. Do you know what I mean?
Yeah.
And like August is tight a little bit if they want to walk with nothing.
Mm-hmm.
And that is sort of been with the PRECICE nails. Now as these stride nails are coming out, I think it might be a little bit easier to waver a little bit quicker, because it's a little more robust to handle the load when the bone is still healing.
Right.
So it might be quicker than that, but I would say that's a reasonable time frame. They start in the middle of May, they're, full weight bearing with crutches by the middle of August, and hopefully nothing by September. And so that would, I would say, comfortably for 5 to 6 centimeters of lengthening.
Okay, that's very cool. And I think that's similar to what I did. I did it, July, but it was like that summer, and then by the early fall, I was back up. What about a normal walking gait? Everybody's like, when they start walking, obviously there's going to probably be some stiffness in the abductor muscles and whatnot. When do you typically see your patients start to resume like a normal walking gait? Is that a little bit further down the line, or is it all dependent on how aggressive they are with their physical therapy and whatnot?
I think it's a little bit of both.
Okay.
People are generally recover at a little bit of variable rates, and so I would say that person who got lengthened in May, was walking with crutches by August, nothing in September, they could probably be comfortably going to the gym, working out, October, starting to get on the anti-gravity treadmill in September, full weight bearing by October, as far as like maybe getting some jogs in on the treadmill. And so as far as normal walking gait, it just really depends on like how quickly they're rehabbing. But the sort of what I would say is patients don't want anyone to know that they had anything done, right? So like, say you see your friend in May before you have a surgery, and then you see them back like in October or November, I think they wouldn't even know. I feel like they, if you were going out to dinner and you're walking, or you went to walk on the boardwalk, or you know what I mean? Like, now, if you say you went to the beach and you're walking on sand, might be a little awkward. Do you know what I mean? But like, I feel like as far as normal daily activities, and you're not wanting anyone to know, I feel like, October, maybe middle of November, and say you wanted them to go for a little jog, say you wanted to go a little jog or bike riding with your friend, and I mean, I think they'll be fine. I think that patients, families or friends or whatever wouldn't say, oh my gosh, you got taller, but it would be the same person. Do you know what I mean? Like, they wouldn't be like noticing any gait disturbances. So I feel like if they wanted to get like, say it was like a lacrosse player, I really feel like they wouldn't feel like they're 100% maybe for 8 or 9 months if they wanted to get back to their cutting, pivoting, like whatever. But for normal, like regular activities, like, running, walking, I'd say maybe between the 6-month mark is probably pretty good. So May to October, I think, or November.
Okay, that's a really good time frame. A lot of people like to hear within the year, and that's exactly what you're saying. And that's true. It's all a part of how aggressive they are with their physical therapy, which is my next point. It's a well-known fact that consistent physical therapy is a huge part of this in terms of a good turnout. I know firsthand that Sinai has a wonderful physical therapy team. You are super crucial about it. Like, you got to go to therapy, and not slacking off, because a lot of people, if they don't show up to their sessions, they tend to get complacent, and then that complacency can lead to problems. In fact, I remember you went out of your way and made me a molded cast to use, at night to keep all kinds of things intact. Do you feel that like people who aren't going to physical therapy, or like international patients that come to Sinai, do you recommend that they stay on site for their lengthening phase, or do you think that it's okay that they go home and do physical therapy back at their place?
Well, that I feel like is one of the keys to success for this treatment. You have to be on top of it. And so if you want to talk about complications, ankle stiffness, knee contractures. And so it's so crucial. And so if patients are from out of town or international, I, make them stay for the lengthening procedure. So the nice thing is we have Hacker and Pat's house across the street. And so they have the option to stay. It gets a little tricky when patients don't. I always tell them they have to have a lengthening buddy. So if they want to come and, get lengthening from us, they have to have someone that's going to be able to help them stay at the Hacker and Pat's house and bring them to and from physical therapy and keep an eye on them and help them, because, I guess there's some liability issues with patients staying by themselves and not having like proper help or whatever, because, literally they've just had both their legs broken, and so, you know what I mean? It's a lot when patients ask like, hey, how am I going to be ready after surgery? Well, you're going to need help. And so you're buddy, you know? And so that's why I say, as long as they have someone to stay with them at the Hacker and Pat's house, and they go across the street and they come to us for PT, you know, and honestly, as it gets more and more, the length keeps going on and on, you know, sometimes it's 3 days a week, sometimes it's 5 days a week. And it's really important to keep up with that, because that's how you prevent a lot of these problems. You know? And so it's just important for the therapy people to know all about the limb lengthening techniques. Like, if they're not going to be able to stay with us, or you know, I've had some patients fly in from Boston, and so like, we'll have our PT department check up on them, but also they're in communication with the patient's therapist back in wherever they're coming from, because it's important to know certain techniques for protecting the knee when you're working on contractures and things like that. Maybe making them, like you had a special cast or a brace to do it some nighttime splinting, and that's very custom. And so it's just really important. I think people, you know, the surgery is critical, but the physical therapy afterwards, because it's a dynamic device, is even more critical.
Right. Yeah, definitely. I think that you're 100% right with that. Me, myself, you told me how critical it was, and I did get stiff. I was a bodybuilder, so having some of that tight calf and stuff is preventing that, but you told the therapist, work, and I ended up perfectly. So how important is it to be flexible before the surgery? Is it important to maybe start to, if you know you're going to get your surgery next year, let's say next May from right now, is it important to start working out and stretching now, or is it like it's not super important, it's all genetic? What are your thoughts on that?
I tell people to start stretching. So when I see them in the office, I'm doing all preoperative examination and range of motion. And if they aren't tight, I tell them they got to work on it. It's important. Oh yeah. I mean, like, I probably repeat myself, Victor, right? Exactly. Like, God, I've heard this before. But like, I do it all the time. I tell people, because you know what? It's only going to get worse. If you're tight now, it's going to get worse. And I feel like, you know, some people are big, like you're a big guy. And so when you're working out so much, sometimes you do get tight, and your muscles are so big, sometimes your range of motion isn't always like perfect, you know? So I think it's really important to stretch ahead of time.
Dr. Conway, pain is another big fear factor for a lot of patients, but it's very individualistic. I mean, for me, the first week or two was a little rough. It was a little shocker, but it went down dramatically after that. Plus, I'm used to pain. But a lot of patients just can't fathom what breaking both legs are going to feel like. What do you tell a prospective patient to kind of expect, or how to manage their pain? What's your best advice?
Well, I mean, I think a lot of it is expectations. And so you have to be in a psychologically good place, I think, when you're approaching this situation. You know, it's like anything. Pain is weakness leaving the body. You know what I mean? You want to try to, if you want it, you'll put the time and effort in to get through it. Right. And so nothing that is worthwhile is not without some effort and hard work and sweat and things like that. And so I feel like if they approach it with the attitude that I'm going to do this, I'm going to get through it, that's a much better place to come from than that I don't want any pain, I'm scared, I don't want any pain. And so we do our best. Like, we do a lot of you know, anesthesia can do a lot of blocks. And so a lot of that post-operative pain can be mitigated with like femoral nerve blocks or adductor blocks. And so, you know, it's helpful just for the immediate post-op. We keep the patients in the hospital a couple days just to get rid of that initial post-op pain. And then, you know, we have a lot of regimens as far as like Valium, we can get patients for spasms, and we kind of get them on a regimen that every couple hours they can have something. And the nice thing is, like you said, after you get over the hump of the initial surgery, it's tolerable. And then, you know, if they're diligent keeping up with the physical therapy, they have some discomfort when they're stretching with the PT, but it's nothing crazy as long as they're kind of like staying on top of it, keeping up with it, and get on a regimen of like, maybe they take, you know, their Valium before PT and then their narcotic after therapy. You know, there's a way to get on it where you can manage it. Right. So, like, you know, patients, yes, there's going to be pain. yes, the acute post-op pain we can manage and help in the hospital with IV pain medications, some of these blocks. Then once you get on like a regimen, that, you get in a routine where, you do your lengthening, you do your stretching, you do your physical therapy, you take the Valium, the oxycodone. They're sort of the things we use a lot.
Right.
You can get through this, and it's definitely doable. And, I think people should just maybe connect with some other patients like you to let them know that once you're over the immediate hump, and that immediate hump is really when you're in the hospital under our direct supervision, then it's definitely something that is, manageable. And I would not tell patients that it's pain-free. I would tell them that it's definitely manageable. You'll be able to get a good night's sleep. You'll be able to get around. You'll be able to do your activities of daily living. And you're not going to be sitting there uncomfortable 24/7.
Right.
Yep.
I completely agree. That little hump, and then it's just a waiting game essentially. So very cool. All right, Dr. Conway. So just a few more questions, and then we'll wrap up. What obviously a lot of patients, like you said, is all about the physical activity, getting back to that. You said that it's going to be like 6 to 9 months when they can get back to like the explosive movements and the cutting and stuff like that. But what about like jumping and like sprinting and like all that super high impact stuff? Because we have some people who are avid, extreme athletes. Do you suggest that they even get stature lengthening to begin with if they're at like top level athletes, or do you think that they can all achieve their functionality if they stay within a lengthening goal?
Well, I mean, again, it goes back to goals. If their goal is to be like a world-class athlete, they should not touch their physique. They shouldn't. You know what I'm saying?
Yes.
Like, if there are issues that need to be addressed, like, limb length discrepancy or something that's preventing them from, then they should address that, because that's, necessary. But to take someone who's functioning at such a high level, like an Olympic athlete, and then want to make them taller, I feel like you're taking a chance, because with every surgery, there are risks, and you have to outweigh the risks and benefits. So if the goal is for the person to be like a spectacular Olympic athlete, well, then they probably shouldn't get surgery, because if they're in their peak physical condition at that point, then you're taking a risk, and there's not a lot of benefits, because if that's your goal, is to be an Olympic athlete. So if that person's goal, maybe after they're done being an Olympic athlete, they want to get taller, well, then they're not, the risks maybe aren't as great as the benefits to that person to get taller. You see what I mean?
Yep.
And so I feel like then it becomes a good possibility, because maybe they'll achieve 98% of their pre-lengthened status, but as those Olympic athletes are like the top 0.1%. Do you see what I mean? And so, that's the only other thing is, it all comes down to what patients expect and want. And so I would counsel patients, if they are very happy with their functional status, and don't want to jeopardize that they may want to really carefully consider waiting until maybe that is not as big a priority for them, and then all of a sudden the height becomes a little bit more important. Do you see what I mean?
Absolutely, and I agree. I think that you should wait till after your heyday, essentially, and then achieve that goal, your lengthening goal, essentially, if that's the case. All right, last two questions, Dr. Conway. International Center of Limb Lengthening at Sinai is really unique, because you guys have an awesome team there. I know Dr. Herzenberg, Dr. Asayag, your mentee. You have Dr. Philip McClure, and yourself, the amazing queen of limb lengthening. What are the benefits of being part of such a very experienced and well-rounded team? Do you guys consult about different patients? Do you bounce ideas? Is it just like you have like a really team-centered focus on patient success? What's the benefits of working at an amazing facility like that?
Well, it's from start to finish. So like when patients come in our clinic, we have all the tools even in our clinic for a lot of these things. We have a whole adjustment room full of spare parts for our frames, and some wrenches, things like that. Like we have just even in our clinic, when people come in, we have our stuff set up. And if you went to somewhere else that doesn't do a lot of limb lengthening, I'm telling you right now, they're not going to have a spare room of parts, for switching out. So, and then our clinic staff's experience with a lot of these things, because sometimes patients have to come in on an emergency basis.
Mm-hmm.
And, you know, so they'll make a phone call, we'll bring them in right that day, the same day or a little bit later whenever they come in. So the clinic staff is flexible and understands that these things are dynamic and changing, and they understand the importance of patients coming in all the time. So that's helpful. And then, you know, the OR is great because they're used to all the equipment we use,
Mm-hmm.
and you know, the cases can get done more efficiently and effectively because they're used to all the tools and equipment we use upstairs. It's not because it's not your standard stuff.
Right.
And so that team in the OR is well oiled.
Mm-hmm.
And so it's not just like the other physicians, it's like the ancillary staff is great. The PT in the hospital is great. Like you said, the outpatient PT. So there are all the benefits of, you know, just being at our center. Is like all the other ancillary staff is on the same page, working hard to achieve our results, you know, in the hospital and outside the hospital. And then as far as our colleagues are concerned, it's so nice because we have the volume to maintain all the good staff. And, you know, it's not just me, it's myself and Herzenberg and Paley, Herzenberg and McClure and, you know, Asiag and everyone just working together, and we all have the same protocols.
Mm-hmm.
So then it's really nice because everyone knows what to do. It's not one doctor's doing one thing, one doctor's doing another thing. And so it's just great being at a center that does a lot high volume of this. And then sometimes you get the unusual case, and it's so nice to chat with your colleagues about, hey, what do you think about this? Or, hey, I'm going away on vacation. Can you watch this guy for me? He's in the middle of, like, you know, lengthening or whatever. Can you just keep an eye on him, whatever, when I'm away? And it's so nice because, you know, they have your back, you know, and you can just, you know, bounce things off of them. So I really think it's important having that support for the surgeons and the patients and, you know, all the resources available. I really think it's nice. It's a great place to work. And it's a privilege. It would be hard working somewhere else because you'd be the Lone Ranger, you know?
I completely agree. When I came there, it was like everybody was bouncing ideas. Herzenberg was there, you were there. I just felt so taken care of. That's why I recommend this and had to save this interview for last. It's just amazing. So, Dr. Conway, me being your patient and #1 fan, I knew how to go on and highlight you for the amazing surgeon you are. You changed my life for the better. And so far, there are several people considering limb lengthening who I recommend you for, but they want to reach out and consult with you. Where is the best place and how can they reach out to you? I'll be sure to post all your links in the details, but what are your best contacts?
I'd say the best contact is my email, jconway@lifebridgehealth.org. I get all my email. I check it a couple times a day. And so I usually am pretty good about getting back to everyone. And, you know, even last night I'm getting emails from patients just sort of in the same vein with the same topic, and I'm trying to answer them back just because, you know, it's on people's minds, and, you know, I'm happy to provide the information, and, you know, it's something that people carefully consider before they go ahead and do it. And it's kind of nice if they have a relationship with the doctor before they even meet them. You know, they're sort of realizing that, you know, I'm easily accessible. And that's the other thing is you want someone that's going to be around even after you've done your surgery. So, like, patients all have my cell phone number. Yeah. So I make sure that, you know, if they're having a problem or an issue or a question, they can text me. You know, email is great, but I always tell people to text me if they want me right away if they're having a problem. And so that I feel like is also really critical. So, yeah, but that's the best way. jconway@lifebridgehealth.org. And thanks a lot.
Yeah, thank you. Yeah, and I'll be sure to post all that in the links. Dr. Conway, any final words that you like to kind of say to any prospective patients who are considering you for limb lengthening?
Sure. I would say, you know, stretch a lot, take vitamin D, and just make a list of pros and cons, things you can do, things you can't do. And, you know, because it's going to be a 6 months out of your life, you know, sort of endeavor. And, you know, just decide how important it is to you. And I feel like that would just be really, you know, a critical thing to tell patients is, you know, is this worth spending 6 months working on, and, you know, pick the right person. Right. So I feel like your success is directly determined by how hard you want to work, how important it is to you, and having the right surgeon and tools available to you to complete the task successfully.
Absolutely. All right, everyone. That is Dr. Janet Conway of the Rubin Institute for Advanced Orthopedics at Sinai Hospital in Baltimore, Maryland, in the United States. She is an amazing surgeon. Dr. Conway, thank you so much for your time.
Victor, thanks a lot. It was so great seeing you. I really enjoyed your interview, and looking forward to watching some of your podcasts.
Yeah, and by the way, she is super accessible. It's been 8 years since my surgery, and I'm still talking to her. So thank you, Dr. Conway.
Oh, take care, Victor. Thanks again.
All right, have a good one.
All right, bye.
I hope you enjoyed the interview with Dr. Conway. Not only is she very experienced and pays close attention to detail in limb lengthening and deformity reconstruction, but she's also very accessible, compassionate, and caring with all of her patients, which I can attest to. If you're interested in reaching out to Dr. Conway, all of her contact information can be found in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.